So it's a pleasure to be able to have a discussion with Dr. Shah and Dr. Morgenthaler. So what we're going to do is have questions that come up in Q&A, and also some questions for the panelists in the use of their test in clinical practice. So first, with the new data that was just presented, I would really like to get your assessments on treatment recommendations that may be different for patients that have such a significant risk after breast conserving surgery, and still a higher risk after breast conserving surgery and radiation therapy for those who are identified as having that residual risk type. And, if you would be so kind, Dr. Morgenthaler, to start with that.
Sure. So I think that those patients that have that residual risk, and that residual risk that occurs even after radiation, those are difficult patients that we really have a conversation about. The benefit clearly exists for radiation reducing their risk to much lower levels. But these are patients, depending on the clinical scenario, their age, their family history, so forth, that, we would also, discuss the potential benefit of completion mastectomy in those patients. Now, I don't necessarily recommend that for those residual risk patients, but it's certainly a conversation I have with them, and talk about the pros and cons of doing more extensive surgery and avoiding radiation altogether to reduce their risk, versus proceeding with radiation and endocrine therapy and close observation.
Yep. Dr. Shah?
Yeah, I think Dr. Morgenthaler highlighted the key points. I think one of the things I discussed in those patients who wish to pursue breast conservation is I may consider adding a boost. There's been some data suggesting that boost may further reduce the risk of recurrence, and this may be the population that's for. I think moving forward, whether there be considerations for mastectomy, or maybe this is the population that had some benefit in B43, which showed a benefit, albeit not to meet the specified endpoint. I think we have to look at these patients and say, instead of being concerned about undertreatment, these may be the patients, overtreatment. These are the patients who are concerned about undertreatment and maybe intensifying therapy in this subset of patients.